Mike, thank you so much for taking time with me to tell me what you're building at HealthMe. Mm-hmm. You know, your story is a very personal one. I know you're a surgeon and you came up against this challenge and decided to do something about it. So tell me that story.
Yeah, so I've been practicing for a little over 20 years. I'm seeing more and more people who want to pay directly for their care. And I think everyone's looking for more transparency in healthcare pricing and a better way to transact healthcare. And one of the problems is most physicians don't know how to retail their services. They really don't take cash, amazingly. Now, if you ask any doctor if he takes cash or she takes cash, everyone will say yes. However, if you call their office and tell them you don't have insurance or you're out of network, quite often you'll get turned away. And I was seeing this in my practice. And the only way I realized this was I practiced in my hometown and my friends kind of called me out on it, honestly. Like I'd get these text messages, emails, phone calls at night saying, Mike, you know, I tried to get my kid in to see you. They hurt their knee playing soccer today. Your staff wouldn't make me an appointment. And I'd say every time, I get it, I'm booked out a few weeks, I'll get you in Friday or whatever. And they would say, Mike, that's not the problem at all. The problem is I'm not insured. And I made it clear I wasn't looking for a freebie because I'm your friend. I was willing to pay cash, yet your staff said, you don't take cash. You only take insurance, and I was turned away. I'd go in the next day and I'd say, you know, hey, why wouldn't we make Mrs. Smith's kid an appointment? And they'd say, sorry, Dr. Havig, we didn't know that they were your friend. And of course I'd say, well, it doesn't matter if it's my friend. I mean, someone that wants to pay me cash for my services. We need to do a better job. We've got a piece of paper, you know, we've got something like this that just has the pricing on it. And they're like, oh yeah, we forgot about that. Great, we got it. But they didn't get it. So this happened time and time again. And I mean, it's pretty frustrating, right? Like, why can't we get this right? And so we finally kind of looked inward and we said, what we're really doing is asking our front desk employees and the people out answer the phone to predict the service I'm going to provide and then predict what that price might be, because healthcare is very fragmented. Depends if it's a 5-minute or a 50-minute visit. And then negotiate a fee with that self-payer. And that's just impossible to do, right? Yeah. And so when we realized that, we thought, okay, step one, we need to bundle our services, right? It can't be 5 minutes or 50 minutes. It's just a flat fee for the visit. We need to include common services, whether in my case, maybe an x-ray. In the case of other docs, maybe it's a lab test or something like that that's commonly done. And at the end of the day, we need to be able to transact that in an efficient manner for the patient. You know, be able to let them pay in advance, know their costs, not get surprise bills rolling in for 30, 60, 90, 120 days. And at the end of the day, what I want to do is empower patients to know the true cost of their health care, to be able to transact it digitally like they do everything else in their lives. And at the same time, it's a win for the doctors because they're reaching an audience of patients who they were previously turning away. And it actually really drives revenue for them, which is the crazy thing, because most people, I think a lot of medical practices and a lot of people just in general think that we as physicians want to confuse people. We don't want to publish our prices. It couldn't be further from the truth, right? Like, I mean, I want more business, right? At the end of the day, I want to take care of patients who need my services. And if they're not coming to see me because of fear of high costs or inability to get past my front desk screeners, they're going to end up in the emergency room where they're maybe spending thousands of dollars to have their ankle sprain looked at, or in a walk-in clinic where they might spend hundreds of dollars, but ultimately just get referred back to my office if they have anything.
So you were practicing as a surgeon, you came upon this issue at your own practice, and then you really went down through the sort of component challenges of the price bundling, how to actually administrate this, and you tried to solve it for yourself. Mm-hmm. Plenty of people sort of solve problems at that micro level and sort of don't expand beyond that, but you started a company, HealthMe.
Yeah. Yes.
And you decided, hey, let's go bigger with this. So what was that process like?
Well, I mean, so a couple things, you know, honestly, when we started doing this, I think we were all surprised, me and my staff, actually how much business it was driving. We're like, wow, we didn't think this, you know, I thought it was my occasional high school friend who owned a restaurant or was a 1099 employee. Well, it turns out there's a lot of those people in every community, you know, and we were like, wow, this is really something, this is pretty cool. But then other people wanted it. So the surgery center I work at, they're like, hey, you're bringing all these direct payers. How do we make it easier for ourselves?
And what they want is, they want the bundled payments.
Yes.
What are those pieces that they're desiring?
Yeah, so they want to make it easy for the staff. They don't want to one-off negotiate every one of these, which they were doing. So they want the bundle, they want a clear price, but they didn't know how to build the bundles and set the pricing, right? And then they wanted the payment piece, right? So we know we're going to get paid at the time of service. We don't have to chase people down for the money. And if we can process the payment and cut down on the administrative burden, now we can offer a better price, right? I mean, the statistic, I think, depends what you read. Roughly 25% of the healthcare spend is on the administrative side. And if we can, probably can't get rid of all of that, but if we can eliminate 15% of it, then we can charge 15% less, right?
Yeah,
so everybody's a winner.
Yeah. Have you seen prices able to come down a little bit? I mean, do you feel like this is good for the patient financially?
Definitely. Yeah, so it's interesting. I mean, this is just an interesting observation of mine, and we've seen this time and time again. When you're asking people to publish prices, it brings some accountability, really, right? Like this, it's just one of those things that happens with this. So if you're calling a practice and they don't turn you away and say, okay, Logan, we're happy to see you, we get it, your self-pay. And you say, what's it cost? They're going to usually quote you the sticker price, which might be $1,000 on something they're willing to take $200 from a commercial insurer for, because they're not accountable to anybody but you. And that's terrible customer service, don't get me wrong, but they're not exposed, right?
Sure.
And when you ask them to publish their pricing on their website like we do, they've got it out there, right? And now they feel, actually most doctors, I think, probably underprice their services because they don't want to feel like the bad guy. They don't want to be the expensive player, right? So we have a lot of groups. I mean, real world example, I was out to lunch with my brother and sister were in town and they had some friends. And one of them asked about my company, and I was like, oh, well, just take out your smartphone, look up one of our clients. And they looked, it was my practice actually, and they said, what, I can see you for a little over $200? It includes an x-ray? And I'm like, yeah. I thought they were like, oh, that's too much. And they're like, oh my God, I can't believe it's that inexpensive. And
it's
crazy.
The knowledge piece is just part of it, just not knowing.
Yeah, exactly.
And you're speaking to the power of accountability and transparency in innovation writ large, which is why I'm so inspired by what you're doing, because I think it has applications across the field.
Yeah.
When you start shining a light, here you are in one niche of surgical centers and orthopedic surgery, and yet, I mean, where do you see this going?
Well, I think, our platform's really applicable to any medical specialty, right? From primary care. Like, wouldn't it be great if you could just buy an annual checkup, maybe male age 40 to 60, and you get a package that includes the labs and other studies that are based on, kind of evidence-based medicine recommendations, and be able to buy that for a fixed price, or a heart health package if you want a screening. So I think it goes into a lot of different specialties. I think big picture for me is, I think we were talking about this one point, like where would we be 15 years down the road with this? I mean, what I envision is all healthcare will be transacted in a transparent manner, whether it's on our platform or others. Like whether you're insured or uninsured or underinsured, whether you're a self-funded employer or whether you're, a commercially insured, traditional commercial insurance company, that you know the cost in advance, right? And as for physicians, we wouldn't have to screw around with these pricing games where we charge X, but we know we're going to get paid Y.
No one wants that.
And so that's where I see it going. And then connecting, I think for us personally, what we're really doing at the end of the day is building a network of transparently priced bundled care. And then how we deploy that network. We deploy it like we're doing now, but I see a lot of potential partnerships with digital first companies where, digital first is great, and that's the direction I think healthcare is going. But what do you do when those digital patients need in-person care, need true brick and mortar care?
Yeah.
I think we can provide the network for those companies, right? To kind of smooth that transition from digital to personal. It's still a reasonable, transparent price.
Yeah, and the patient, the user has certain expectations from their digital experience that they want to have carry over to the physical. They're used to how they pay, and again, we're used to more transparency with our online payments. We don't screw around with those prices. You got to know what you're going to get charged for.
Exactly.
So, Mike, love what you're doing. Love that you're leading the charge with price and transparency in this field, and I'm excited to see how that scales up. So thank you for taking the time.
Hey, thanks a lot. We're really excited too.
All right, thanks, Mike.
Yeah, thanks a lot.